My name is Ethan Veneklassen, and I'm the Head of Advocacy and Communications here at ID 2020. We're delighted to have attendees joining us today from every corner of the globe. So let me begin by saying good morning, good afternoon, or good evening, wherever you are, and welcome to the second installment of the ID 2020 Summit Sessions webinar series. We kicked off this series 2 weeks ago with a discussion about what it's going to take to achieve ID 2020's vision of good ID for all. Today, we're going to get a little bit more focused as we explore one of the hottest topics in digital identity, digital immunization certificates. And we're incredibly privileged to have a world-class panel of speakers with us today. While the pandemic has made it impossible for us to come together in person, we're delighted to offer this webinar series as part of ID 2020's ongoing effort to keep our community connected, foster collaboration, and continue to learn from one another. We'd rather see you all in person, of course, but this online format does have a couple of benefits, most notably that it has allowed us to open these sessions to a broader audience, unconstrained by the limitations of space and the need to travel. And before I turn things over to Dakota, I'm also excited to announce that our 4-part series has become a 5-part series. Congressman Bill Foster of Illinois has agreed to join us on November 19th to share his perspectives on digital identity and talk about the Improving Digital Identity Act of 2020, of which he is the author. I'd also like to take this opportunity to thank our partners at Biometric Update for their support of these Summit Sessions webinars. With that, it's my privilege to introduce our moderator for today's session, ID 2020's Executive Director, Dakota Bruner.
Thank you, Ethan. I'm really excited about today's session and can't wait to hear from this incredible panel of speakers. I don't think it's an overstatement to say that the COVID-19 pandemic has upended all of our lives. But for those of us who work in, or in my case, adjacent to global health, the pandemic has brought renewed focus and urgency to our work. We've watched the international community mobilize with unprecedented speed to develop and deliver safe and effective vaccines in what will be the largest vaccination effort in human history. Perhaps the most notable example of this is the COVID-19 Vaccines Global Access, or COVAX facility. The COVAX facility is a joint effort of Gavi, the Coalition for Epidemic Preparedness Innovation, CEPI, and the World Health Organization. This collaborative effort was launched to accelerate the development of vaccines, preemptively build the necessary manufacturing capacity, and purchase supplies of vaccines so that 2 billion doses can be equitably distributed by the end of 2021. This monumental effort is setting a new standard for global collaboration. If we were together in the same room at the moment, I think this is where we would all pause for a well-deserved standing ovation. But what is less clear, though, is how individuals will be asked to prove that they have received the COVID-19 vaccine and are thus safe to return to work, school, travel, or other public activities. While low-cost and easy to distribute paper-based certificates, such as the Carton issued by the WHO and required for travel to certain countries, are prone to loss, misuse, and fraud. So today, governments, employers, and health systems are faced with an urgent need to rethink how, and as important, when and for what purposes, individuals will be required to provide proof of immunization. If done right, digital immunization certificates could offer a path to restoring global economic activity, international travel, and resuming life as we once knew it. They could allow individuals to provide proof of vaccination across institutional and geographic borders with complete control over what information they choose to disclose and with whom. For those who work in digital identity, this is an exciting opportunity to step onto the public stage and to solve one of the most pressing challenges of our time. But while the rewards are high, so too are the stakes. It's hard to imagine a use case for digital ID beset by such a wide range of technical, ethical, legal, and operational challenges, all of which must be overcome. As we speak, solution providers around the world are frantically developing digital credentialing solutions, sometimes absent the guidance and coordination necessary to ensure that these systems are interoperable, that they protect patient privacy and civil liberties, and that they serve the needs of all people, not just the privileged few. And so as bullish as we are at ID 2020 about the transformative power of digital identity, we also believe that this moment demands a coordinated global effort, undertaken deliberately, soberly, and with full consideration of the various risks. The decisions that we make today about digital immunization records for the COVID-19 response will shape the trajectory for digital ID for a generation or more, and we have just one chance to get it right. This is obviously a very complex and multifaceted topic, and we have a lot of ground to cover today. So let's get to it. We have a great panel for you today. People I have been honored to call friends and colleagues over the past few years. So let me take a quick moment to introduce them. I'll introduce all four of our panelists and then turn it over to each to provide a short introductory remark. Dr. Seth Berkley is one of the most widely recognized figures in global public health. Dr. Berkley is a medical doctor, infectious disease epidemiologist, and since 2011 has served as the CEO of Gavi, the Vaccine Alliance. Gavi protects the world's poorest children by improving access to new and underused vaccines. In its 20 years of existence, Gavi has vaccinated more than 820 million children in 73 of the world's poorest countries. Fully half of the world's children are vaccinated by Gavi. And in 2015, Seth led Gavi to its second fundraising round, raising $7.5 billion in donor commitments. And in June of this year, he raised an additional $8.8 billion, which will allow Gavi to reach 300 million more children and prevent an estimated 7 to 8 million deaths by 2025. Skye Gilbert joined PATH in 2016 as Deputy Director of PATH's Digital Health Program, and in 2019 was appointed Executive Director of Digital Square. Digital Square is a PATH-led initiative funded and designed by the U.S. Agency for International Development, the Bill and Melinda Gates Foundation, and a consortium of other donors. The program seeks to improve how the global community designs, uses, and pays for digital health tools and approaches. Prior to joining PATH, Skye worked in health and information systems, first as an academic researcher living in Senegal and China, then as a consultant at the Boston Consulting Group, and finally as a program and strategy officer at the Bill and Melinda Gates Foundation. Dr. Brad Perkins is a physician, scientist, and entrepreneur. He's currently the co-founder and chief medical officer at the Commons Project Foundation, a nonprofit public trust established to build platforms and implement services that give individuals, or that allow individuals to enjoy the full benefits of technology and data while maintaining control over their digital lives. Two of their recent projects include COVID Check, a tool which helps individuals around the world understand and reduce their COVID-19 risks, and Common Pass, a framework developed in partnership with the World Economic Forum to create a secure and verifiable way for individuals to document their health status as they travel and cross borders. Dr. Perkins started his career at the US CDC, where, among other things, he led the 2001 anthrax bioterrorism investigations following 9/11. From 2003 to 2009, Dr. Perkins served as the chief strategy officer at the CDC. And Areiel Wolanow is the chief technology officer of BLOK Solutions. The BLOK Bioscience COVID Care Program offers businesses and organizations testing services, digital passports, and data insights to protect the safety and privacy of their employees and customers. It's worth noting that BLOK Pass is one of 5 identity solutions to have received the ID 2020 certification. Prior to launching BLOK, Areiel served as one of IBM's key thought leaders on blockchain, machine learning, and financial inclusion. He has addressed the G20 on financial inclusion and is currently an advisor to the UK Parliament. We are absolutely delighted to have such a distinguished panel of speakers for you today. Thank you all for taking the time out of your busy schedules to join us for this discussion. So as I said, each panelist will start with about 5 minutes of opening remarks. Then I have some questions for our panelists, and I'm hoping we can make this a discussion. So panelists, feel free to raise questions yourselves as they may come to you. And we will, of course, be taking audience questions. So please submit your questions through the Q&A function in Zoom, and we will get to as many of them as possible within the allotted time. With that, Seth, welcome and take it away.
So thank you, Dakota, for organizing this, and I look forward to hearing the exciting discussion. Let me start with a little bit of a scene setter. So you talked about COVID. It is obviously the worst pandemic for about 100 years. And it has affected most countries on Earth and has had enormous economic effects. Now, I think on north of $16 trillion effect on the economy. So I think for the first time, the world is waking up to the fact that epidemics can have this dramatic effects. Now, if you look at vaccines, vaccines are the most widely distributed of all health interventions. We reach now a little bit more than 90% of families in the world with routine vaccines, which of course means we don't miss, we miss 10% of them, and obviously the goal should be to get there. But one of the challenges, as you described, is that in at least in the poorest countries, but in many wealthy countries as well, we don't have systems to systematically track those that are vaccinated and those that are missed. So one of the amazing opportunities, maybe a silver lining here, is if we can take advantage of the emergency to create systems that can be used to work on COVID vaccines, then these may have relevance as well for routine vaccinations, which is obviously one of the most powerful public health interventions. Now, let me just say a word about COVAX. We started, as we always do, thinking about developing countries, but we realized if we only looked at developing countries, there may not be vaccines because they might get bought up by the wealthy countries and therefore not have them available. So in a novel way, we said, let's try to think about how we could have vaccines available for everybody. And we didn't know where there would be interest in this, particularly at a time when the world has moved away from multilateralism to much more, many countries, nationalism. But we've been quite excited by the response. Right now, we have 181 countries that have engaged in the COVAX facility. We expect that to rise to 190 or to 195. So right now, more than countries that represent more than 90% of the world's population are engaged. For poor countries, we're working to try to make sure that those vaccines get financed and delivered. For upper middle income and high income countries, we're helping them with procurement because they will finance their own vaccines and their own delivery. And of course, we're working with the amazing manufacturers who are trying to produce a largest amount of vaccines in a short time period ever in history. And as you said, it's not only the production, but it's also going to be the delivery, which will be at record levels. One last thing I'd say is that we talk about vaccines, but it may be vaccines, not one vaccine, but multiple vaccines. And one of the challenges then is going to be for vaccines that require more than one dose or different vaccines are circulating in a country. The ability to track that is going to be absolutely critical for the safety of the patient, as well as we're going to want to be able to do pharmacovigilance, given that these vaccines will be fairly new, and to make sure we can track them.
Seth, thank you so much. Skye, if I can turn it over to you for your perspective.
Thank you. I think this is a really important moment in time, and I think that there's a lot of great ways that digital technologies can support addressing some of the challenges that Seth highlighted around increasing the visibility of who's vaccinated and who is not in the context of COVID, but then also more broadly. Digital technologies are ultimately, though, amplifiers. They can do a lot of work to reduce inequities, but there is a risk, depending on how they're used, of increasing inequity. And so I think that's a theme I really want to talk through from a couple of different lenses. One is just thinking demand side and what communities throughout the world need. And I think that both your remarks, Dakota, and Seth's really clarified the value of having something in place that can better differentiate who's received a vaccine and who hasn't. I think that it could go a long way towards reestablishing trust across communities, help restart those economies, and maybe get us back from the trillions of dollars in losses. It'll be important in thinking about any digital identity, and especially for this one, to make sure that individuals and communities understand what data are being captured about them and how their information is used, not just from an ethical perspective, as you were describing, Dakota, but just very pragmatically. When we've done deployments of identity in places like Tanzania, we've seen pushback because caregivers didn't understand what the identity was going to be used for. And so it's really important to be thoughtful about how this is rolled out so that it builds trust within communities rather than erodes it. The other risk in terms of equity is that we are still in a world where the digital divide is very prominent. It's gendered. Women, according to GSMA's most recent report, Women are 10% less likely to own a phone in LMICs, 26% less likely to access mobile internet. You also have differences by socioeconomic status, by geography in terms of who has access to digital systems. And so you don't want to put in place a world in which we have a certificate class and a non-certificate class. And I think bridging that divide is going to be important. These are all challenges and they're risks, but I think they're very solvable problems. I think they're very solvable. We have a lot of tools at our disposal and a lot of lessons learned from mechanisms like Gavi that have managed to reach 90% of families. So I think this is about proactively accelerating efforts to increase access to digital solutions, and then thinking about linking any sort of digital solution to an analog or biometric component or something for those who haven't quite yet bridged that digital divide. On the supply side and thinking about equity and digital certificates, norms, standards, and interoperability are really important to enable a seamless exchange of information between an identity program and national health information systems. WHO has established a smart yellow card working group where they're having a lot of these discussions, and they have a website up so you can go there and learn more. And I think that that's going to be essential for driving product requirements to help make that information flow securely. Coming back to the theme of equity, the benefit of this is if this information can feed into national health information systems, it helps national governing bodies program what they're doing with their health systems and informs their work. If they don't have access to that information, they lose the ability to use it to make evidence-informed decisions. So that interoperability, norms, and standards, I think, is really important. There were the specific information requirements for the vaccine or vaccines remain unknown. If you're having one dose versus multiple doses, the volume of information you need to capture per person changes. There's questions about how you capture natural immunity versus vaccine-derived. So I think there's a lot of questions about the information capture and how different information needs might inform product requirements. And the final note I'll make is there's a really important opportunity here to support routine immunization programs, also to strengthen civil registration and vital statistics systems that I think could be really beneficial for our national health systems worldwide. The final point I want to make is on the financing of something like a digital immunization certificate. International development and humanitarian response efforts are really good at funding early stage digital innovations. And we as a community have less of a successful track record in financing the ongoing operating expenses to support and sustain the scale of digital innovations. Our greatest successes to date have been when country governments like India finance annual operating expenses for digital out of tax revenues, or when mechanisms like Gavi can provide reliable, adequate annual financing to maintain these systems once they are established. So a big question I have is what can we learn from the Gavi co-financing model to inform how we think about the long-term financing for digital immunization certificates? And I think this is one of the most important equity questions we have, because the financing will determine whether this is something that's available to everyone or restricted to who can pay. Thank you.
So much, Skye. Next, I'd like to turn it over to Brad. And I think your experience both with the Commons Project and the CDC to reflect on what what Seth and Skye have shared and to share your own perspective.
Thank you, Dakota. We're at a unique juncture where we believe at the Commons Project we have an extraordinary opportunity to improve health and give citizens much more control over their health data. At the Commons Project, we're committed to building global scale digital platforms that serve the common good and identifying specifically layers of technology that neither single governments nor traditional technology companies are well suited to deliver. We started the Commons Project by building the Android equivalent to Apple Health. We believe the ability for citizens to control not only mobile health data, but their clinical health data from EHRs is incredible progress in giving people the kind of control they need to take care of their health and to access healthcare services. When the pandemic began, we immediately turned our efforts to building digital platforms and tools for the COVID response. It's actually a great story of innovation starting in East Africa, where we first implemented tools from the Commons Project, some GIS platforms for that group of 6 countries to monitor and respond to the COVID pandemic, as well as COVID Check, our risk assessment tool that you mentioned in the introduction. One of the things that the Eastern African community immediately asked them to help us with after that was to help them build a technology platform that certified negative COVID-19 diagnostic testing results among truck drivers that were bringing food from the port cities within Kenya and Tanzania into the other 4 landlocked countries in the Eastern African community. So an essential task that needed to be conducted in the context of the pandemic. We recognized from that request, not only was this an urgent need in the East African community, but it was a general global need. And at that point, we partnered with the World Economic Forum to begin building what we're calling a common trust framework to enable safer and more effective international travel. This really builds directly on the WHO international health regulations and the yellow card, as you mentioned. Since July of this year, we've gotten incredible traction at a global level, now working with most of the major airlines in the world, as many as 50 different countries, and other travel and health stakeholders. We've recently completed a couple of international route trials of Common Pass to support this exchange of COVID health status data in the context of the pandemic and international travel. Of course, we're focused on laboratory testing results right now, but we're preparing and working very hard to be prepared for COVID-19 vaccines. So in parallel, we're working with a number of major stakeholders and decision makers in the vaccine world to provide in that suite of COVID-19 health status credentials, vaccination status. And of course, this is important beyond international travel and certainly beyond COVID. Because we're building technology infrastructure that's specifically intended not only to support the international travel use case, but the entirety of a digital yellow card, not only for COVID, but for all of immunizations, with the aspiration to build a digital longitudinal lifelong immunization tool for people. So we're working with a consortium in the United States to implement the provision of digital vaccine credentials in a high-income country. As soon as we begin vaccinating healthcare workers and other high-risk persons in the United States, we're also working with our colleagues in Rwanda to do a similar implementation demonstration of the digital yellow card in Rwanda. And we're discussing that with other East African community countries as well. So I really appreciate the opportunity to be here. Thank you.
Thank you, Brad. And Areiel, finally, over to you.
Thanks, Brad, and indeed to Skye and Seth. I don't think there's anything the rest of the panelists have said I don't agree with. We formed BLOK in February for the specific express purpose of putting together a solution to address this situation. And several things were apparent to us from the very beginning. The first of which is that it takes a full ecosystem to put together an effective COVID response. Having great tests doesn't help if you don't know how to deliver them and how to get them into the right hands. having an immunity passport doesn't help if you don't have a system for capturing the tests and getting the results. The ability to deliver the tests doesn't mean anything unless you have the support of the ecosystem of employers, of public-facing venues who are ready to adopt them. It's pretty clear to this group, because it's fairly self-selecting, that we all care about privacy and self-sovereignty and data ownership. We felt that having a truly self-sovereign solution was important for some reasons beyond just the fact that it's self-evident the right thing to do for, I would assume, everyone who's on this call. One is that it was absolutely critical as a driver for adoption, that people would, and as we have seen, have rejected track and trace solutions, pandemic management solutions that haven't implemented those standards. But the other reason, and the one that I'm hearing more and more from our customers, is that it creates a huge burden for the companies and the governments to adopt a completely new set of PII, of personally identifying information. Very, very sensitive data that creates risk and cost and burden of regulatory compliance. Due to the vastly diminished cash flow, this is not a level or a burden that many companies are prepared to hold. So yes, self-sovereignty is critically important because it's something we believe in, and we would never do anything that wasn't. It's critically important for getting adoption, but it's also a hugely commercial imperative. We need to deliver something that doesn't create a mountain of cost and a burden that many companies that are already distressed can't afford to have. So we looked at a lot of solutions. We looked at what other people were doing. We saw a mix of good and bad solutions in terms of preserving privacy, in terms of the quality of custodianship of data. We saw people doing some very interesting things with blockchain and other DLTs. We took a different tack, which was the best way to help avoid enabling the growth of the surveillance state or creating this burden was not to have the data at all. So what we've implemented at BLOK is an interaction framework in which the data never leaves the control or the possession of the individual who the data is about. So there, I'm a blockchain expert. It's what I've been doing since 2014. There is no blockchain in the solution because it's not needed. There's no database. There's nothing in the center. If we do get hacked, or indeed when, because I believe it's inevitable given the level of focus of the world on this, the perpetrators will find nothing because there is nothing there. I want to share exactly one screen, and it is not the sort of screen that you normally would find somebody leading a demo with or a solution with. I want to share the terms and conditions of our application. Most applications have 4 or 5 pages of fine text which nobody ever reads. These are the actual terms and conditions that are listed for our application. It's what you have to agree to when you sign up to use it. And sure, share screen is enabled, and share this. So these are our terms and conditions, and this is the entire license for using our software. Your data is yours and yours alone. We don't have a copy and never will. Your data is never shared. This app has been designed to make it impossible. Anytime someone wants to use your data to answer a question like, is it safe to let you into a building? They have to get your permission first. You hold the only copy of your data. If you ever want to delete it for any reason, you don't need to ask anyone's permission. Simply delete this app. Those are the terms and conditions of BLOK Pass and how we set this up. We're live now with our first customer. We are going to be going live with a number of other customers with at least one sovereign country before the end of the year. So we're very, very happy to be able to share this. I completely agree with everything that has been said about the digital divide. about open standards, about interoperability. These are all central, but we think that the way to truly bring about a revolution in self-sovereignty is to walk the walk and to give people the data that is theirs and to have them own it.
Fantastic, thank you. So I'm now going to pose a handful of questions to our panelists. I'll direct a few of these questions towards individuals sort of reflecting their opening remarks, but for our panelists, feel free to jump in if you have things you want to say. And then some of these will be much more general. So Seth, first, thank you for the incredible work that you and your colleagues at CEPI and WHO have done to launch the COVAX facility. It's truly remarkable. And building off of your remarks, can you share a bit more about Gavi's vision for digital ID for vaccinations, including for COVID-19? And I think maybe building off of Skye's points about sustainable financing being critical for equity, what role do you think Gavi could play in ensuring the necessary partnerships, but also that there is sustainable and equitable financing for digital immunization records moving forward?
So let me answer that question first and then come back to something that Areiel said, which is interesting. Maybe we can pivot to an interesting conversation on that. So in terms of the economics, so prior to COVID, we had this discussion often because it cost us somewhere around $28 to fully immunize a child. And if it cost us, say, $30 to immunize that child, but you were more efficient in doing that and you could get better coverage, it would, in fact, pay for itself. And so one of the questions was, where do you have to get sustainability? And of course, what Skye said is absolutely right. For the poorest countries, you can expect to get assistance from outside to help with that, but only if it makes sense and is cost effective. But over time, as countries get richer, they have to take on, the cost of things. And that's how we do our co-financing. And then eventually they transition out of Gavi support and they continue to pay for their vaccine. So the idea would be to have a system that is integrated and it allows and shows real value for doing this. Now this, let me pivot over to Areiel's, points, because the interesting thing is what he says is absolutely right if your goal is to try to show that you're immune or not immune, but it's not what you want to do if you want to find somebody who's missed their second dose or, has missed a different vaccine. And so one of the challenges we have is how you create systems that can do both things, that can protect somebody's privacy, protect identifiers, but at the same time have an ability to be able to use them for the public health good. And this is where it's going to be complicated around the COVID disease, because if you look at it, we're estimating that if you can get to 20% of the population, you will begin to tamp down the epidemic. It has to be 20% globally. It isn't about a few countries having 100% and everybody having nothing. But once you start doing that, that means that if you need to have more vaccinations going on, you're going to have to be able to track them over years. If people need boosters, you're going to need to track that over years. If people got a different vaccine that had less immunogenicity and a later generation vaccine comes in, you're going to want to know that. And of course, you're going to want to know if there are side effects, to be able to do that. So I think for this particular set of conditions, you're going to want to be able to do both of those things. And I think that's going to be the tool that provides the help from a public health point of view. Over.
Great challenge, Seth, and probably one of the very first technical hurdles that we had to cross. You're absolutely right. It's not enough to have a self-sovereign record. You have to have a way of reaching people. What we decided to do was to create a framework that, and I guess to take a step back, the good thing is that we are now in a technological space where it's possible to square that circle, to have a way of communicating, saying, we need you to come in without ever actually having a database of who you are. Using an interaction framework, what you can do is you can send out guidance to your entire universe of, whether it's at a community all the way to a country level, in such a way that each individual only gets the guidance that is relevant to them. So if you want to make sure that people who meet a certain set of conditions come in for a booster shot, you can send a message out and the message gets filtered where? It gets filtered on the user's device because that's where the data is. It's not with you. So it is possible to do exactly what Seth is talking about which is why it's so fantastic to be, to be working on this here and now, because technology has evolved to the point where we can actually square that circle and deliver the guidance that people need, and give it to them from reliable sources, from Gavi, from reputable NGOs, from governments themselves, not from social media or from something their cousin said. So absolutely, that's right, because this is about a lot more than just the self-sovereign record. It's about reaching people.
I think that's actually a nice transition point. I mean, Skye, one of the things that I know Digital Square, focuses on is investments in necessary digital infrastructure. And it strikes me that digital immunization certificate solutions will often build on much of this digital infrastructure. And so I'm curious how Digital Square and your partners are, preparing to make sure that that underlying digital infrastructure is there, and what role do you see digital ID or credentialing solutions playing kind of in this ecosystem?
That's a great question. I think that identity is actually a foundation for the overall ecosystem. It's a very intimate representation of individuals. And so I think that it's a very integral part of the ecosystem. There's a few things that Digital Square is doing to prepare and also adapt as demand for digital health solutions increases, and as the type of characteristics you need in those solutions changes. So in terms of, I'll talk a little bit about the products, and then also I'm seeing a lot of questions in the Q&A around standards and interoperability, so a little bit about work there. In terms of products, we're currently working on a landscaping of where people, we're doing a landscaping of where people are currently adapting digital solutions that are already in country and being deployed, and just adding COVID related modules. So there's roughly 11 use cases that range from tracking equipment like PPEs to figuring out, cases. So there's a number of cases, and we're mapping. And so that is, we currently are processing data. We have documented over 2,000 deployments, country tool deployments across over 130 countries. That information is going to be live, I think, in early next year. And we're also working with WHO to put that into the Digital Health Atlas, which is a global inventory tool. So we're in conversations there. So that will increase visibility in terms of the infrastructure of digital solutions already in country systems that are deployed, where they've just activated a module, and that allows for scale to happen quickly. And then that's a place where new innovations can build on and from. So that's one thing that we're doing right now. Another thing that we pivoted to back in March or April is within the Open Health Information Exchange community, we started a community of practice around norms and standards for COVID, because we realized we were starting to track the way information was being codified, and we're finding that across 10 or 11 systems in March, there were different data labels and data definitions across systems. And so there is a community of practice that has been live for the last 5 or 6 months to try to co-chaired with World Health Organization, to try to come up with a common taxonomy for all systems to use. And that community is open, so anyone and everyone can join, and maybe we can follow up with a link if folks want to engage. And then Digital Square has resources from our investors, and we are actively running notices, calls for applications and proposals for digital health providers who want to align their products to that taxonomy. So we've done 3 rounds of proposals and continue to want to support people to align to common taxonomies, norms, standards, so that, like I said earlier, we can facilitate that flow of information where it's helpful to informing health system priorities.
Fantastic. Sort of jumping off from that into this conversation around interoperability and open standards. It seems clear that even from this panel that there will be more than one digital yellow card or digital wallet. And so I'm curious, what are the views of this panel, and I'll open this one up to the floor, on the use of open standards, mechanisms like what Skye just described in order to encourage some of that standardization, and really how do we avoid centralized platforms or siloed solutions. Areiel, if you not, or Brad, jump in.
Yeah, no, I mean, it's an essential part of trust. And the hypothesis that we're really testing at the Commons Project is can you build technology platforms that are instruments that build global trust? Build global trust among individuals and citizens, and build global trust across ecosystems of other stakeholders. And foundational to that, there's a number of technology principles, but the urgent, scarce resource in our belief are organizations that are using technology to build global trust. And I think actually Gavi is a great example of an organization that is building global trust through its efforts, not necessarily with a strong technology lead, but certainly that's what we're after at the Commons Project. We're committed to open source. As you know, Dakota, we feel very fortunate that the Linux Foundation has started a Linux Foundation public health project. And we plan to work with them in the context of what we're doing with Common Pass.
So Dakota, as you well know, because we went through the very rigorous certification process for ID 2020, undertaking that commitment to interoperable standards was one of the many criteria that we were evaluated against. So again, I think that's a given to the audience here. What I'd add to what Brad just said is actually very short. The way to avoid creating centralized data is data stores is quite simple. Don't.
Indeed. Well, as we all talk about the sort of technical path, and the implementations, and even I think some of the need to develop legal and regulatory frameworks around digital ID systems and digital immunization records. One of the things I think we often don't talk about much are the barriers to adoption, and really specifically for individuals, for end users. What is it that might prevent them from adopting it? I think some of this came up in your opening comments, but maybe starting with you, Seth, what do you consider to be the most significant barrier to the adoption of COVID immunization certificates, and what can we do to overcome these barriers?
I mean, there are many barriers, and trust is an important one we've already heard about. We've heard about cost. We've heard, and we haven't discussed it here, but obviously penetration of internet or connectivity in communities is going to be a problem on a global scale, although obviously that is improving. But I will just put a story out that Dakota knows well, because I first met Dakota at TED when I was doing a TED challenge to try to figure out how we could track vaccines, forgetting people now, just vaccines. And the point was, you can buy a banana and we can tell you what tree that banana was grown on, given the supply chains tracking, but we haven't had that for vaccines. And until recently, we haven't had, barcoding on vaccines. And, just recently, after all those years, we now have a requirement on secondary packaging. Bang, when COVID hits, all of a sudden now people are saying we should have it on primary packaging on the vaccine, which may be very important for all the reasons we talked about, to be able to track specific vaccines, lots, side effects, all those other issues. But one of the arguments that kept us from doing it was chicken or egg problem. Nobody has any readers, so why would you put barcodes on things? Well, of course, nobody has any readers because we don't have anything that's barcoded. So I think, in a sense, we have to take a leap of faith And my leap of faith is that, and the way I tend to describe it is 50 years from now, everybody is going to have, this type of information, the ability to move forward using digital technologies for banking, for healthcare, for many things. And the issue is, how do we prepone that? How do we take that vision to now? Because now is when we need it, and now is where we can make a difference in the worst pandemic. But lastly, this is, it's evolutionarily certain we're going to have more pandemics. The population's getting bigger, the forests are getting cut down, global warming, people moving, all of that. So in a sense, you can call this the worst pandemic in 100 years. You also could call it a test case for the next one. And how are we going to prepare for it? And these tools are going to be critical. But again, for me, it's protecting the individual, but it's also about having these as public health tools. And Brad certainly knows, how we ultimately use these things for surveillance and how we use the ability to be able to track diseases is going to be an important part of overlaps, but doing it with the type of protection that everybody's talking about. So I think that's the challenge in front of us.
Great. Does anyone else want to pick up where Seth left off?
Actually, I think he articulated it perfectly. I have nothing else to add.
I'd say the only other thing I would add is that when you think about barriers, it varies by location. And one of the other things that we've been doing a lot of thinking about are what are the characteristics of a community or an ecosystem, and then as a result, what is important in order to reach people in that community or ecosystem. And so, Seth mentioned trust, cost. There's a number of other things like offline functionality that matter in some communities and less in others. I think that there are increasing calls for getting a lot more specific about how product requirements vary by context, and then meeting that context where they're at in terms of price, in terms of all of these attributes. And so I'm hopeful and optimistic that it'll be easier and easier to answer this question in the coming years, and that might accelerate us in solving the chicken egg problem.
And let's not forget literacy and language and, a range of other issues.
Certainly. And something we've seen in the projects that we've been working on in Thailand, issues around informed consent, for example. We've done a lot of work to try and assess the degree to which participants in these projects, are truly practicing informed consent. And what you see is, explaining some very complex, digital technology to those who are sort of interacting with it for the first time requires thinking about informed consent in a very, very different way. And that's just one example I give of where I think there's huge amounts of work to be done, and where knowledge sharing across the community is going to be so critical, because we don't really want to reinvent the wheel each time. So I'm starting to see a handful of questions pop up in the Q&A. I'll start weaving those in, but please, for those in the audience, continue to post questions. There are a few that have come in, I think, sort of aimed towards Areiel and Brad, and we're thrilled to just have two different solution providers with us today. So the first one was really around, first, why did you choose the use cases that you did? And kind of what steps you're taking to ensure that your solution adheres to the values of good digital ID. And as a follow-up, how are each of you getting input from the people who are ultimately going to use the solutions as you go about architecting your approach? Brad, I'll kick it over to you first.
Sure. So we started by getting input from truck drivers on the ground in Kenya and Tanzania, and taking sort of a human-centered design approach quite seriously for the East African community. The prototype for Common Pass was actually built there. We then partnered with the World Economic Forum to talk to the broader range of stakeholders around the world, and really co-designed the open framework that we're putting in place with Common Pass. And I mean, why this use case? There's sort of an underlying technical reason, and then there's just sort of a global demand reason. There are many stakeholders and many countries and many people that are desperately and legitimately seeking a means to travel internationally. And then we were also very attracted to the framework that WHO has had in place with the international health regulations, which is the global international framework that really specifies this operating system that we're trying to replicate in the digital world for common vaccine.
So I think that, again, Brad has said nothing I disagree with. The thing that is most important to us, again, as Brad has done, is, if you want people's input, ask. We've piloted here in the UK with a series of gymnasiums. We've also engaged with Brazil with both employers and health clinics to engage directly with people. This is where we got some early validation of what we saw as as the barrier to adoption. The notion that people aren't going to use your solution if they think that they're being tracked. Even in a country, and it's most telling if you look at adoption rate in Singapore, which is arguably a country with a fairly rules-tolerant culture. People do not want to use the app. And it can be argued that the Singaporean government has a fairly high level of trust intrinsically amongst its people, but they still don't want to use it. And if they're not going to use it in a place that is as collectivist as Singaporean culture, they're certainly not going to want to in a place that is as individualistic as the US.
Fantastic. Well, I think we have time for about one more question before we wrap up. And I'll try and ask something that everyone here can jump in on. So, Skye, I really appreciated your comment at the outset about the risk of creating a credential class and really the necessity of ensuring that this is an inclusive approach, that the financing supports inclusion, that that there are multiple different solutions that, as you say, are contextually relevant where they're being deployed. And so I guess a question to each one of you is, as we close, what are the most important things that you as your organization, you individually, or the collective, you think need to be doing in order to ensure that we are moving with both sufficient urgency to address the challenge at hand, but also ensuring that we're doing so in an inclusive manner? Skye, I'll put you in the hot seat.
As a recovering consultant and a game theory researcher, I come back to the economics, and I really think that the way financing is structured and flows is a major driver for equity. And so you can do a lot of things around the margins in advocating and drumming up demand, in trying to think about how you architect your supply. But the people who benefit from the financing and how that's equitably distributed, I think is the most important thing for an equitable future. And then I think there's some really lively points in Q&A around things you can do alongside digital certifications, but I'll just pause there and let others respond.
Brad, do you want to jump in next?
Yeah, I think we're of course committed to serving everybody in the context of the Commons Project. I think the financing is critically important, but so is government regulation. So I think, in the United States, for example, we see companion diagnostics creeping into the regulatory schema for administration of certain drugs. It seems to me that we're at the point that we should begin to talk about companion digitals. That when people are offered vaccines and other, incredibly important and valuable health interventions, they should be offered a set of digital credentials that goes along with that to help build their longitudinal personal health record and to use those credentials where it's useful in their lives. So I think, financing is important and regulation is important too, to eliminate some of the structural barriers that we have.
Areiel.
Regulatory clarity is critical, and is the difference. I think that governments are finding it extremely challenging to provide that clarity for their own purposes, let alone for ours. The other thing that I would add that is critical is education, is to provide a way of allowing people to understand not only what the appropriate health guidance is, but what it means to be the custodian of your own data, of not only what that enables and doesn't enable, but also about the responsibilities. It's self-sovereignty is an idea that has been floating around for a while, and people don't really understand what it means to say you own your data now. It's not something. It's not a concept that people are familiar with grappling with. And if we want to deliver this vision and make it a reality, there's a significant vector of education that we are going to have to provide in a consumable way. Otherwise we'll fail.
Seth, over to you for the last word.
I think it's really important that we do take a global view, and certainly this set of panelists do. One of the challenges we think about these new technologies, and we think we want to go to the most sophisticated place in the world and take advantage of it. But I think what we've seen over and over is that technology can often be such an enabler. It can leapfrog over existing systems that don't work. And I just think about years ago in East Africa, where first people didn't believe that they would pay for cell phones because, it was expensive and people were poor. And of course, they exploded at an incredible rate. And then, M-Pesa came along and people said, well, peasants aren't going to use this type of banking system. And it exploded. And, Kenya had the highest percentage of people, at that point banking electronically, et cetera, et cetera. And the reason I wanted to say that is, I think that these technologies are very powerful, and it's the places really that are the most difficult, the hardest to reach, with all of the problems Skye talked about, whether it's gender or language or literacy, et cetera, where technology can be the game changer and allow us to do these types of activities. And, it's an opportunity to build a platform for COVID, yes, but it's also for other health interventions and beyond. And so I think that's where the excitement is. I know we need it in the West as well, but the real excitement is in the developing world, where they can, it can do so much for people.
I want to quickly follow up and underscore what Seth said with some data. I happen to lead the team that built the credit scoring engine for M-Pesa. So I was out in Nairobi building that. And what that changed in the country cannot be overstated. When M-Pesa was first released, the number of people who could qualify for the microfinance that was always available as part of it reached a peak of about 500 microloans per day. Once we actually allowed people, most of whom were unbanked, to use their M-Pesa data to qualify them for credit just based on their cash flow, that went from 500 a day to 50,000 per day. A year and a half after doing it, the GDP per capita of the country doubled. So the ability of technology to implement this change is something that I've had the sublime privilege to see firsthand. This really can make a difference.
Fantastic. Well, we are just almost at time, and we've covered a lot of ground in the last hour. I'll try and very, very briefly synthesize some of the key points, but I don't pretend that this captures the full depth of this discussion. So I think one point that came through very clearly from Skye and others, the critical importance of financing and how we think about those financing flows to ensure equity. On the technology side, the necessity of solutions that simultaneously are privacy protecting, yet also are interoperable and built on existing digital infrastructure in order to meet public health needs. So this brings us back to the necessity of standards and interoperability. I also, something that I saw come up in the Q&A is the importance of alternative solutions or companion solutions for those without a smartphone, making sure that the solutions that are being deployed are appropriate and that there's sort of a multitude of different approaches. And I think one of the other kind of key messages is that as Seth said, there's an expectation that these solutions will be commonplace and part of our day-to-day lives in the not too distant future. And with that, there's an opportunity right now to ensure that we respond to the current pandemic and do so with urgency, but also this recognition that we are building digital infrastructure. And so there's a need and an opportunity right now to ensure that it's done so correctly and that it is equitably distributed so that it's accessible to all. With that, I want to thank our panelists for joining us today. I'd also like to thank you, all of the attendees, for taking the time out of your day to participate and for your thoughtful questions. As Ethan noted at the onset, these webinars are part of ID 2020's ongoing commitment to foster collaboration towards a future with good ID for all. And I'd like to just quickly remind those who are here today that we are doing this part of the series. Our next session is 2 weeks from today on October 29th. And this one focuses on digital ID for financial inclusion. We have a world-class panel of experts in this discussion, including Ajay Bala, the president of Cyber and Intelligence Solutions at MasterCard, Rod Boothby from Santander, Greta Bull from CGAP at the World Bank, Giannis from GSMA, and this session will be moderated by ID 2020's Head of Public Sector Partnerships, Meredith. So we look forward to seeing you all in 2 weeks, and thank you again for taking this hour with us.
Thank you.
Thank you all.
Take care.
Thanks.